You have to assess the brachial artery here and on that side.
Make sure it's equal.
Yes, it has to be symmetrical. They have to be equally strong. Okay. And then we assess now the radial arteries. So the radial arteries will be here, okay, and on this side. And then on the pinky side will be the ulnar artery. Okay. So we also do, like we said, we want to assess the collateral circulation. We ask the patient, can you squeeze your hand several times? Quick, faster, faster, faster. Okay, and then hold. Okay, and then press on the radial and ulnar arteries. Open your hand. Okay, you see that it's blanched. I will release. You see the blood flow towards the yes, this is the modified Allen's test. So that is called a positive Allen's modified Allen's test.
And
So-
positive is normal.
That's what we're looking at. That means there is good collateral circulation. This is a test that is done usually by the RTs before they do arterial blood collection, because they need to make sure the radial artery is the best for doing arterial collection. But they need to make sure that there is no problem with the collateral circulation. So they need to do that first. They need to document that it's a positive modified Allen before they actually do take the sample. Okay. Now, if for example this one is negative, check the other hand.
So you only check the other one if it's negative. Okay.
Okay. Now let's say what they call this. This one was a positive Allen test, and then they did the they took blood from here, the arterial blood from here, and the radial artery went into arterial spasm, so it just constricted. We won't have to worry that the hands will turn gangrenous because you have that collateral circulation from the ulnar. Okay. So we do this in phlebotomy, and one of my students was saying, in one of the hospitals, she was asking, what is this modified Allen test? And the doctor said, oh, I'm not really sure. I think that's a new test. What's a new test? It's not a new test. It's been existing for the longest time. So he probably didn't know what a modified Allen test when it says positive. So that's what we want, a positive modified Allen test. Okay. So after the ulnar arteries, then we go into capillary refill. Okay, so again, what is the normal capillary refill?
Less than 3 seconds.
Less than 3 seconds. Okay. Okay, next.
Inspection and palpation of the legs.
Okay. Oh, basically, make sure that you don't forget to inspect the skin in terms of the color. Inspect inspect for any edema if you see any swelling on one side or if it's bilateral. Inspect also for lesions. The dorsum of the hand, check for the temperature. Okay. And then you do your pulses. Now we do the lower extremities. So the same thing. We start with assessing the skin color, pinkish undertones, that's what we're looking at. Assess for the temperature, so here. So that's why your patient has to be in cycling shorts all the way to the dorsum of the feet. And then we look for the may I?
Yeah, sure.
Okay.
I have leggings on.
Okay, so you assess for any superficial veins. What we're looking at is, what we're looking for are varicose veins. Okay, no varicose veins. Why do you have so many scratches?
I don't know. I fell a lot being a kid.
No, but this one is no.
I know.
Like
Look
this
at
one.
that. Look how bad I thought I got beat up during. I don't know. Yeah, they're really ugly. I tried covering them with foundation.
Oh my god.
I do.
It's not.
I
No,
do.
it's not too bad. But
They
I was
are
just wondering, like this one here, it's new. Okay. Okay, so here
Just
we're looking at the
Scratch your
presence
legs
of
at night.
any ulcers. If you have, because it's difficult with women because women shave their legs, but in guys, and do you guys shave your legs?
I got some
Okay, here it is.
Okay. So here's the thing: if your patient is a male and you look at the legs and you see an area which is bald, okay, and it's shiny, then think of arterial insufficiency. Okay. So that does not mean they only shave that part.
So as you get older, you
Richard, you
lose,
checking?
like women lose their hair anyway, so that wouldn't be like a good indication that you're older.
That's why. So you have other tests
Okay.
that you can do.
Looks like you scratched your leg.
I did
Yeah.
get really itchy, I think.
So use Aveeno. It
Yeah.
it's a very good lotion to calm down the irritation. Okay, and then we have of course the femoral pulse. We palpate. You don't touch that area, and then we assess the inguinal lymph nodes. Okay, you know where it is by the groin,
Right.
and then you have the popliteal pulse. So can you please lie down? So when you assess the popliteal pulse, I need to put this down because.
I would have heard this, but
Okay, so you have to make sure that the knee is bent, okay, and then feel. First is strong, even with even
Fine.
over the legging. Okay, so you have that one, and then assess the other. Okay, so make sure the knee. Let it go. Okay, make sure that the knee is bent. Okay, and then you have the. Let's go first with the posterior tibial. The posterior tibial, this is the medial malleolus. Okay, medial malleolus, lateral malleolus. Behind the medial malleolus, that's where you will feel the posterior tibial artery. Okay, good. And then you have the dorsalis pedis. Okay, so can you please dorsiflex your foot? Okay, here. When you're feeling for the dorsalis pedis, lightly, because if you press too hard, the artery might roll in between the ligaments. You can feel it. Okay, so that's for the dorsalis pedis. And then,
Arterial insufficiency.
okay, the arterial
We went through
insufficiency.
that, didn't we?
For
Not
the,
yet.
For the hands.
Oh,
Not yet.
okay.
I thought that was like if you had patches, right?
Yeah.
That was when we.
Yeah, but that's just
Oh, just the leg.
hold on. You have to do other tests to really confirm it.
Oh,
So here's a test for arterial insufficiency. Let's say you palpated the femoral artery and you felt that it was weak. Okay, so you now check you really need to confirm for arterial insufficiency. Relax. Lift it.
Okay.
Okay.
Oh.
It has to be 12 inches above heart level. Okay, and then flat. What? For a minute.
Okay, yeah. Good thing I didn't fall into my leg under the
Okay, sure. Observe the foot as it's up here. You see it start to blanch.
Right.
okay. Oh, okay, that makes sense. I get that.
Yep.
Okay.
Right here while you're flapping.
Then you have to move here because you will have to sit. I will ask you to sit and then dangle your foot. You will see the blood rush towards the foot if there is no arterial insufficiency. Some more. Come on.
Keep on flapping. You're getting your
Workout.
exercise in.
It's like a workout, huh?
Just the toes and the foot. Okay. Another 10 seconds. Yeah, I want to make sure that they can appreciate it very well. Okay. All
If it
right.
looks white now.
All right. So you can sit up. Okay. See the flow.
Oh yeah, it instantly went.
So that is less than 10 seconds. No arterial insufficiency.
I missed it. Let's do it again.
You can try the last.
I think we should check the other one.
Okay, and then the last test will be for the venous competency. So for the venous competency, this is when you see varicose veins. She does not have varicose veins. I'm sorry. So if, for example, she has varicose veins here, so it might be throughout. So press on this area, and then about 5 to 8 inches above this area you're pressing on, feel for a pulse. Okay, because it's hard to see, because it's hard to imagine it, because there is no varicose vein. If there is a pulse, that means there is no venous incompetency. The veins are competent, they close very well. Now, if you feel a pulsation, that means the veins are incompetent. And so you now have like some pressure here, which now restricts the flow of the artery.
Wait, so if you feel a pulse,
It's bad.
that's bad.
Mm-hmm.
Okay.
All right. And then the last will be to auscultate the arteries. So when you auscultate the arteries, again, you have to use your belt because you will not hear a sound unless it's the bruit you're appreciating. No sound at all. That's normal. Okay. So we start with the aorta. So here, below here, will be the aorta. Okay. You have the right and left iliac arteries, right and left renal arteries, and then of course right and left femoral arteries, which you do not palpate and auscultate. Aorta, right and left iliac, right and left renal. Okay, so this will be the assessment for the heart and peripheral vessels. Now, like I said, the second part of the skills exam will be on the dummy wherein you will put the different sticky paper, okay?